Someone buried a cat under the building at one point.
Wow.
And, quite a little story in that building, but I think clearly when you guys come and see our ribbon cutting, of which you're all invited, we will be having meet and greet sessions. We'll have hot foods the night before. We'll have refreshments during the ribbon cutting itself. We want to show the community that we're here for you. But I do this enough to know that the last thing you need is someone like me up here just speaking or preaching to you. You probably have a host of questions you're dying to ask me, so why don't I turn it around and say, what would you like to ask me about St. Luke's?
What are going to be the hours of operation in town?
That is a great question. What I would tell you is in the physical therapy, we typically run on a 4 10-hour day week. So quite frankly, if it follows a lot of our others, it'll open in the morning at 7 and it will close around 5:30. Now that said, a lot of our centers, depending on how busy they get, Jim Thorpe, to use an example, started that way, and now it's open from 6 in the morning till 9 at night. It's all dependent on volume of people and how many people need the service.
And that'll be 7 days a week, I'm sorry?
4 days a
4
week
days
for
a week.
physical therapy. The Rural Health Center will be 5 days a week, and that typically starts out 8 to 4:30, although it could change depending on the need. We start out with what we feel is a basic plan, and then we listen to you guys as to, we don't know the culture of McAdoo, of do most people work? Are most people retired? Do most people work in Lehigh Valley or Wilkes-Barre, so you need to be open later? So you guys will teach us over the year, and then we adjust the hours accordingly. Yeah.
Would this be just for this county, or could Luzerne County patients come to you?
Sure, anybody can come to us. Whoever is in need of care. And let me explain a little bit about what I mean when I say wellness. Wellness means the opposite of illness, okay? So you don't have to have a sore back, a bad knee, or a sore shoulder. You don't have to be after surgery. You can just be like you guys are right now, walking around healthy. Come in there and get more healthy. Our staff will teach you exercise programs. There'll be treadmills and equipment, fitness equipment to exercise. You'll be able to come in. You'll be able to join our memberships. And then you're a part of it. You're like a stakeholder at that point in the building.
I have a question.
Sure.
When you first started, you said that irregardless of insurance or payability, so let's say that I can't pay for anything, and I come to your place, I get all the services free.
That is only the Rural Health Center. I want to be specific on that. Our Rural Health Center is subsidized by all of our tax dollars, and that allows us to do
In
that.
other words, you do get a subsidy from the state of Pennsylvania to operate that.
We actually get it from the state of Pennsylvania and the federal government based on the fact we're an underserved area. It's not a lot, but allows us to at least break even. We can't make a
And
profit.
who constitutes that?
Who decides that?
Yeah.
I would imagine those same politicians you were educating me on earlier, they probably somehow decided that we are a medically underserved area.
I have a question.
Sure.
You stated, and I didn't get it quite exact, that you will be bringing jobs to McAdoo.
Yes.
And do you have an approximate timeline when all this will happen? And how many jobs?
I'm not sure exactly how many, and the reason I can't speak specifically is, remember, we're going to be two separate businesses. The Rural Health Center, regardless of ability to pay, you get to come in and use all those services, and that's the doctor and the nurse practitioners. On the physical therapy side, we do require insurance or medical assistance, no problem, and I guess really somebody could self-pay if they wanted to, but that's the back business. In our fitness program, that is purely a cash-paid business, but memberships, for example, you can come visit us 5 days a week for a year for $250. And if you thought about that, without weekends, there's 300 weekdays on average. 300 weekdays, because some people throw in leap year at me every time I say this. On average, 300 weekdays. So that's less than $1 a day to work out, and I think you'll be impressed when you see the equipment we bring you.
Is that per person, or do you offer family plans?
We have group memberships, family plans, individual plans, monthly plans. Some people say, boy, I just can't pay $250 at once. We have 3-month plans, 6-month plans. The most cost-effective is obviously the annual plan, because it's $30 a month or $250 for the year. And your services are then good at any. Say you're visiting a loved one in Jim Thorpe and you decide, or you're going on a trip somewhere and it somehow takes you to Maundy City, we have 9 of these facilities. You're good to work out at any of them. It's not just locking you into McAdoo.